Bill.
H.R. 2775, a bill to condition the provision of premium and cost-sharing subsidies under the Patient Protection and Affordable Care Act upon a certification that a program to verify household income and other qualifications for such subsidies is operational and for other purposes.
Pursuant to House Resolution 339, the amendment printed in House Report 113-206 is adopted and the bill as amended is considered read. The bill shall be debatable for 1 hour with 40 minutes, equally divided and controlled by the chair and ranking minority member of the Committee on Energy and Commerce, and 20 minutes, equally divided and controlled by the chair and ranking minority member of the Committee on Ways and Means. The gentlewoman from North Carolina, Mrs. ELLMERS, and the gentleman from New Jersey, Mr. PALLONE, each will control 20 minutes. The gentleman from Texas, Mr. BRADY, and the gentleman from Michigan, Mr. Levin, each will control 10 minutes. The chair now recognizes the gentlewoman from North Carolina, Mrs. ELLMERS.
Madam Speaker, I rise today to speak about the economic disaster facing all Americans on October 1st. Nearly 3 years ago, I decided to run for office for one primary reason: to defeat and repeal Obamacare. 3 years later, this terrible law is set to be implemented, and the dire warnings and predictions are already coming true. This past summer alone, we saw 3 major delays in the law's implementation, from the employee mandate to consumer price caps to the issue we are debating here today. Congresswoman Black's bill, H.R. 2775, the No Subsidies Without Verification Act, is a first step at attacking the latter. The premise of this bill is quite simple. Serving as the stewards of taxpayer dollars, it is one of our most important jobs as members of Congress. After all, dollars wasted by Congress or improperly spent by the executive branch has a direct impact on the budgets of families across this country who are struggling to pay their bills. This is why I was appalled by this summer's announcement from the Department of Health and Human Services. In the 600-page rule issued during the July 4th holiday, HHS stated that they would no longer verify income for Obamacare subsidies. Instead, the Obama administration would now rely on self-attestation and sample audits when launching Obamacare exchange subsidies, an initiative that is estimated to cost over $1 trillion over the next decade. After receiving criticism, HHS announced that they would reverse course and extend audits to all applicants. Yet, to this date, the administration has issued no formal change in the rule to codify this policy. In other words, they are saying one thing and doing another. As it stands today, the rule issued by HHS reads, "The exchange may accept the applicant's attestation without further verification." And yet, while verification has been removed, the fines remain in place. Any applicant who enters information improperly could possibly face a $25,000 fine. If the mistake is knowing and willful, the fine could grow as high as $250,000. As Ronald Reagan famously said, "Trust but verify." If history is any guide, these claims of accountability will be disregarded unless oversight is enforced. This only reinforces the need for the No Subsidies Without Verification Act. The bill would simply require certification systems to be in place so that the administrators can successfully and consistently verify eligibility before any premium and cost-sharing credit are paid out. Similar language was adopted by the Senate, but the bill before us would implement a bipartisan consensus and protect taxpayer dollars. It would do so by requiring the Inspector General of HHS to certify that income verification is in place before precious taxpayer dollars are wasted and abused. I urge my colleagues to vote in favor of H.R. 2775, and I yield back.
The gentlewoman reserves.
Yes, the gentlelady reserves.
The gentleman from New Jersey is recognized.
Thank you, Madam Speaker. I yield myself such time as I may consume.
The gentleman's recognized.
Thank you, Madam Speaker. The bill before us today is nothing more than another page out of the Republican playbook to delay, derail, and otherwise repeal the Affordable Care Act. Rather than a productive bipartisan effort to ensure successful implementation, Republicans will instead waste more precious floor time to take their 41st vote that undermines and repeals the Affordable Care Act. H.R. 2775 is based on a flawed premise that HHS does not have the verifications in place to ensure that families who are getting financial help are eligible for that help. But my Republican friends, that's simply not true, and your bill will do nothing but prevent millions of hardworking American families from gaining affordable health care coverage. First and foremost, this bill is totally unnecessary. HHS already has stated in regulations that they will check and verify income on 100% of the applications. And if someone receives payments that they determine aren't substantiated, those payments will have to be paid back. 100% verified and reconciled. And here's how it works. To get subsidies to make their health insurance affordable, hardworking Americans and families will submit their projected annual household income through the marketplaces. The data will then be checked against IRS data, Social Security data, and current wage information. If there is an inconsistency, the marketplaces will require additional documentation from applicants. In addition, marketplaces will check employer coverage information from the applicant and their employer against data from a number of employer data sources approved by HHS to verify eligibility for the subsidies. If applicant information and other data do not match, the marketplaces will ask for further supporting documentation. And lastly, all payments of premium tax credits are reconciled by IRS the following year. The income data submitted to the marketplaces are reconciled against the actual wages and health coverage information on the individual's income tax return. If there is an inconsistency, the applicant pays back the excess. So let me repeat that last part, Madam Speaker, because it's the most critical. Even after HHS has verified wage information on each individual situation that arises before tax credits are sent out, the income information will still be double-checked again against actual wages on the individual's income tax return the following year. So if there's an inconsistency, the applicant pays back the excess. There is, again, 100% income verification and reconciliation on the back end. Now, Madam Speaker, both CBO and JCT, the Joint Committee on Taxation, confirmed this, stating that the program HHS has in place satisfies the certification requirements under Section 1411 of the law, proving, again, that this bill is simply irrelevant. But of course, in light of this report, our Republicans at the 12th hour have hastily amended the bill. The new language will ask will basically ask to formally certify, or ask the IG of HHS to formally certify these verification systems, which does nothing but delay the start of the law and deny millions of hardworking Americans from getting the tax credits they're clearly eligible for. Now, I maintained in rules last night, and I'll maintain again, this is not the responsibility of the Inspector General. The Inspector General doesn't do this. They probably can't do this. The IG's office has confirmed these implications by stating that this new language places unworkable requirements on their office and that it has no resources to perform this and that it is outside of its traditional role. And so the Republicans know very well all of this, and that's the exact reason they made this change. It's simply a delay tactic. Again, the IG won't be able to do this. This is not their traditional role. So the only thing that happens here, Madam Speaker, is that this is a legislation which, of course, will never pass. But if it did pass and got signed by the President, which would never happen, it would simply delay implementation of the Affordable Care Act, and that's what the Republicans want. Repeal, delay, defund. This is what they're all about, the 41st vote again to repeal the Affordable Care Act. So, Madam Speaker, today we're 20 days away from October 1st when millions of uninsured Americans will finally get access to quality, affordable health care. No longer will hardworking families worry about getting sick or injured or losing coverage because of the loss of a job, because the Affordable Care Act gives health security and peace of mind. And for those hardworking families that need additional tools to help them afford their health coverage, the ACA will help make coverage a reality. So despite the delay tactics in this bill and millions of hours and dollars spent to derail the ACA, the law is moving forward. Organizations across this country, including labor, small businesses and employers, healthcare providers, advocates, religious leaders, and others, will continue to focus on helping uninsured Americans gain access to health care. I urge my colleagues to oppose this bill. It again is unnecessary delay, but I at least am optimistic knowing that the ACA will move forward and the Republicans will not have success. I reserve the balance of my time, Madam Speaker.
The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Madam Speaker, I recognize Chairman Pitts, the Chairman of the Energy and Commerce Health Subcommittee, for 2 minutes.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Madam Speaker. I rise in support of H.R. 2775 and commend the lady Congressman Black and also Congressman ELLMERS for their leadership on this issue. Earlier this year, we found out that the IRS flagged for further review 90% of Americans who claim the adoption tax credit. 70% of the adoptive families faced at least a partial audit. Only a minuscule percentage of the tax credits given to these families were disallowed. Many needy families saw their returns delayed for months. We also found out this year that hundreds of conservative nonprofits had their applications for tax-exempt status delayed for months and years by IRS agents. Ask millions of small business owners who have spent hours laboring over tax returns. The government doesn't typically operate by the honor system. But when it comes to doling out billions of dollars in new Obamacare subsidies, the government is just going to accept applications without question on the honor system. This is all in the interest of getting Obamacare up and running as soon as possible without any regard to potential fraud. And it's after the old pay and chase model. We're entrusted with protecting taxpayer dollars, not watching them go out to people who don't need them. If the Treasury Department can't figure out how to prevent fraud, then subsidies shouldn't be going out the door. And if the tax subsidy is overpaid to the insurance companies for the tax credits for individuals, guess who pays back the overpayment? Not the insurance companies. It comes out of the individual's pocket. I'm sure I won't be the only person on the floor today to recall President Reagan's words, trust but verify. The byword for Obamacare is just simply trust. The Obama administration doesn't trust adoptive parents or conservative nonprofits or small businesses, but for the purpose of getting the president's signature legislation up and running, they're perfectly willing to see taxpayers get fleeced, and this is simply wrong. We need to demand the administration follow the law. Obamacare was such a landmark piece of legislation. Why does it have to be ignored at every turn?
Gentleman's time has expired. The gentleman from New Jersey is recognized.
Madam Speaker, I yield now 4 minutes to the gentleman from North Carolina, member of our committee.
The gentleman from North Carolina is recognized for 4 minutes.
Thank you very much, Mr. Pallone, for yielding time this morning, and thank you for your extraordinary leadership on our committee and in delivering affordable health care to every American. Madam Speaker, I rise this morning to oppose H.R. 2775. This bill, if passed by the House and passed by the Senate and signed by the President, which I would say is highly unlikely, would require the Secretary of Health and Human Services to certify to Congress that an income verification system is in place before any subsidies can be distributed for individuals to purchase health insurance through the marketplace. Here you go again. Repeal effort number 41. The Republican majority is obsessed with discrediting the President of the United States by using every procedural maneuver imaginable to weaken this law, which was passed by the Congress and upheld by the United States Supreme Court. I invite my Republican colleagues to read a report published by the Congressional Budget Office, which states that HHS already has in place sufficient safeguards for distributing subsidies to assist uninsured Americans with the purchase of insurance. This is not an honor system, Mr. Pitts. It is written into the law, and the Congressional Budget Office recognizes that we do have in place a system to verify the incomes. Mr. Speaker, I'm still fuming. Madam Speaker, I'm still fuming about the 15 Republicans on the Energy and Commerce Committee who on August the 29th sent a multi-page investigatory letter to 51 community nonprofits who have been approved to receive Navigator grants to assist the uninsured with the process. I simply do not understand how the chairman of a committee and a few like-minded committee members can simply author a letter to grant recipients demanding that they answer questions and produce documents. I suggest that this letter exceeds the authority of these individuals to harass and to intimidate grant recipients. I urge the Republican majority to stop trying to discredit President Obama. Stop trying to defund and repeal the Affordable Care Act. It is the law of the land. Millions of Americans are benefiting from it today and in the future. You should be using this creativity and this energy that you're using this morning to pass a budget and lift the sequester, which is hurting families and communities all across America. My friends, get serious, and let's stop playing games with the American people. Thank you, Mr. Pallone, for the time. I yield back.
The gentleman from North Carolina yields back. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
I now recognize Congresswoman Blackburn from Tennessee, Vice Chair of the Energy and Commerce Committee, for 2 minutes.
The gentlewoman from Tennessee is recognized for 2 minutes.
Thank you, Madam Chairman. And I want to commend Ms. Black from Tennessee, my colleague from Tennessee. She has done a tremendous job on bringing this legislation forward, and she brings it forward because of the experience we have had in Tennessee with a program that was called TennCare, which had no verification. It became just-in-time insurance, and guess what? It became too expensive to afford. When you do not exercise appropriate oversight and verification, that is what happens. You incentivize the use. Those that really do not qualify come onto the program. Indeed, we had a governor, a Democrat governor, by the way, that removed about 300,000 individuals off this program. I am pleased that as we discuss and stand in support of H.R. 2775, that my colleagues across the aisle are getting our message. When it comes to Obamacare, yes, delay, defund, repeal, replace. That is exactly what we want to do, because this law has become so amazingly unpopular with the American people. Indeed, with women, over 65% of all American women oppose this law and the implementation of this law. The reason we are bringing this legislation forward is because there is a gaping hole. We know that having self-attestation for getting these taxpayer subsidies in these exchanges is going to lead to an incredible amount of fraud. We're even having estimates of as much as $250 billion worth of fraud that could be going into this program. We're not acting on theory. We're looking at what has previously happened with programs such as TennCare, and indeed my colleague from New Jersey has heard me talk about this for years and knows that when we look at something that is public option health care, that is the public option from which we draw our experience. I yield back.
The gentlewoman's time has expired. The gentlewoman from North Carolina reserves. The gentleman from New Jersey is recognized.
Madam Speaker, I yield 3 minutes to the gentlewoman from California, Ms. Capps, who's a longtime supporter and person in the mix on healthcare, certainly as a nurse and healthcare professional.
Thank you.
The gentlewoman from California is recognized for 3 minutes.
Thank you, Mr. Chairman. My friend from New Jersey, and Madam Speaker, I rise in strong opposition to this bill. Our nation is facing a host of challenges. We need to end the sequester. We need to fund our government properly to avoid a shutdown. We need to increase the debt limit so that we can pay our bills and maintain a strong credit rating. And we must have a full and open debate about what to do in response to chemical weapons used in Syria. But instead of any of these pressing issues, here we are again, at the insistence of the House majority, voting for the 41st time to repeal, defund, obstruct, or derail the Affordable Care Act. And they want to do so as more and more Americans, including my constituents on the Central Coast of California, are now beginning to benefit from the law. Already, 11,000 young adults in my district have gained health care insurance coverage under their parents' plans, allowing them to pursue their education or start new ventures without the fear of going bankrupt if they should get sick. Almost 300,000 of my constituents are now able to get the preventive health services they need without worrying about the cost. And 10,000 seniors have already found relief when falling into the dreaded prescription drug donut hole in Medicare. And in less than 1 month, California families who for so long have been priced out or denied coverage in the private health insurance market will finally get the coverage they want and deserve. Throughout the program, we call it Covered California Exchange, along with healthcare marketplaces all across this country, individuals, families, and small businesses will gain a transparent one-stop shop to compare health insurance policies. They'll also be able to receive financial assistance to sign up for high-quality, affordable, and insecure insurance coverage. And they won't have to worry about being denied coverage for their pre-existing conditions. But this bill before us would erode all of these benefits, essentially blocking hardworking families from getting the affordable health insurance coverage they need. American people have moved on. They want us to come together to improve our nation, not to divide it. So I urge my colleagues to vote no on this bill. Let's get to work on the many critical issues facing our nation. I yield back the balance of my time.
The gentlewoman yields back. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Madam Chair, I recognize Congresswoman McMorris-Rodgers from Washington for 2 minutes. She is the chair of our Republican conference.
The gentlewoman from Washington is recognized for 2 minutes.
Thank you, Madam Chairman. In less than a month, enrollment for Obamacare's largest entitlement program will begin. Subsidies will go out the door on January 1st, and they will go to anyone who claims they are eligible. No verification, no accountability. GAO has told us, and the Inspector Generals for both Health and Human Services and the IRS have told us, that the administration's verification system is extremely vulnerable to fraud. But the picture gets worse. In 2012 alone, Health and Human Services gave out more than $64 billion in improper payments. In fact, the Department of Health and Human Services, the agency charged with implementing these exchanges, has the highest annual improper payment rate among federal agencies. The Department of Treasury, which is responsible for enforcing 47 different tax provisions, is second only to Health and Human Services. The Wall Street Journal recently reported that not verifying eligibility could cost taxpayers more than $250 billion in improper payments. Yet the administration doesn't seem to care. Over the last several months, we've seen the wheels falling off. The delay in the employer mandate, the delay in the consumer cost containment rule, the delay in the finalizing agreements with insurance plans, and now this delay in ensuring that the verification mechanisms are in place to protect taxpayers. This administration has made one thing clear. It will stop at nothing to ensure that 7 million people are enrolled in exchanges in 2014, 2.4 or 7 that must be young in order to make it work, and that subsidies are handed out to as many Americans as possible. The administration's decision to allow enrollees to self-attest to the information provided to the exchanges is not only irresponsible, but ripe for fraud. The only real solution is the passage of H.R. 2775, and I urge our colleagues to support this bill.
The gentlewoman's time has expired. The gentleman from New Jersey is recognized.
Madam Speaker, I yield 2 minutes to the gentleman from Oregon.
The gentleman from Oregon is recognized for 2 minutes.
Thank you very much. Madam Speaker, this is sort of a charade that's going on today. Our Republican friends in many other areas allow, for example, businesses to self-certify in a whole range of areas. And this is not about that. What this is another attempt to sabotage healthcare reform. America's involved with a grand reform. Some of us are in states like Oregon, California, Washington, New York, Maryland, where we're actually working to implement the reform. And our citizens are going to have lower rates, more choices, and subsidies for individuals and small businesses for better coverage. In a lot of America right now, some of our Republican friends have decided to sabotage it. Customers won't get extra help in Alabama, Oklahoma, Texas, or Wyoming, where insurance commissioners won't even review health plans to make sure that they're offered in the new marketplaces to provide consumers with required benefits and protections. In Missouri, believe it or not, the Republican legislature has made it illegal for new health insurance marketplace for state employees to tell people what they're eligible for. And today, this is one more effort to throw sand in the gears. Now, the Republican response, who have no vision for health care, who refuse to acknowledge that what we are working on now, they derisively call Obamacare, actually had its roots in a bipartisan consensus of what's necessary to get more value out of American health care. The health care reform train has left the station. We simply reject today this misguided attempt to sabotage it, and we'll be able for Americans from coast to coast to see the difference from communities that are embracing it and implementing it versus those that are trying to sabotage it. And in the course of the next 2 years, the facts will be clear. Mercifully, what they're going to pass today is not going to be enacted into law, and the rest of us can get to work implementing reform. Thank you. And
the gentleman's time has expired. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Madam Chair, I'd like to yield to myself 45 seconds just to outline some of the things that have already been repealed in Obamacare. As a consequence of Congress passing Obamacare, to find out what is in it, we have found some terrible ideas in the law. To date, the President has actually signed into law 7 bipartisan bills repealing or defunding parts of the health care law. H.R. 4 repealed the small business paperwork mandate, or the 1099. H.R. 1473 cut $2.2 billion from a stealth public plan and froze the IRS budget. H.R. 674 saved taxpayers $13 billion by adjusting eligibility for Obamacare programs. H.R. 2055 made more cuts to co-ops, IPAB, and the IRS. H.R. 3630 slashed billions from Obamacare slush funds. And I can go on, Madam Chairwoman. And I would like to now introduce my colleague from Pennsylvania, Congressman Pat Meehan, for 2 minutes.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Madam Chair. I rise today in support of the No Subsidies Without Verification Act, legislation of which I'm a proud co-sponsor. And October 1st is only days away, and almost every day we see a brand new headline about Obamacare demonstrating the train wreck. As one senator put it, that is their words, not mine. The thousands of rules and regulations and mandates are only increasing the cost of health insurance and dramatically expanding the bureaucracy in our health care. And the implementation of Obamacare has been one disaster after another. Buried in the hundreds of pages of regulations that have been released this summer, including a rule change announcing that the government will no longer verify whether applicants for Obamacare's insurance exchange are actually qualified for the aid. Instead, they will simply rely on the honor system. Madam Speaker, we're talking about billions of dollars here. How can we possibly be relying on an honor system? According to the Wall Street Journal, it's estimated that not verifying the eligibility could result in approximately $250 billion in fraudulent payments. The No Subsidies Without Verification Act will stop any taxpayer funding subsidies until an accurate, real-time verification system is in place to ensure the applicants are indeed eligible. It seems like common sense to me. We need a trusted system in place to stop any waste, fraud, and abuse resulting from not verifying eligibility for Obamacare insurance subsidies. This is being operated through a data hub, which will have millions of persons personally identifying information. Most concerned, this is going to be a honeypot for identity theft and the very purpose for which it was put in place in the first place. This income verification is not capable of being accurately done because this administration has refused to allow the businesses who will give the information to apply. So I am a proud co-sponsor and I urge passage of this bill. Thank you. I yield back.
The gentleman's time has expired. The gentlewoman from North Carolina reserves. The gentleman from New Jersey is recognized.
Madam Speaker, I yield 2 minutes to the gentlewoman from Texas.
I thank the gentleman from New Jersey, and I rise today to ask the incredulous question of how many times do we have to say no, and how many times does the American people have to say, take your hands off my good, Affordable Care Act that has allowed millions of Americans to have preventable care, that is being poised to attack the scandalous high percentage of uninsured in the state of Texas, being the #1 state with uninsured persons. How many times? First of all, this bill is frivolous. And the reason is because there is a construct in this bill, the Affordable Care Act, to deal with all of the questions that they've asked. First of all, it will require that individuals will have to submit their projected annual household income. All income data submitted through the marketplace will then be checked against IRS data, Social Security data, current wage information. If there is inconsistency, the marketplace will require additional documentation. In addition, marketplaces will check employer coverage information from the applicant and their employer against data, OPM, and the shop marketplace, as well as other data sources. It is absolutely absurd for this bill to place more responsibilities on an already sequestered government. If my colleagues want to do anything to provide any substance to what they're talking about, let's put a bill on the floor to end sequestration. There's no resources that would add to the Inspector General's ability to do all that they're said. Let me add further insult to injury, and I want my constituents to listen closely. $67 million was given to navigators to provide the kind of oversight and instruction that these individuals on this bill have suggested they need. But what I find appalling, and what I've not seen in my tenure in Congress, is the numbers of members of the Energy and Commerce Committee that have sent a letter to the 51 navigators governed by the Health and Human Services to require them to send information. I want my navigator that received a grant from HHS to refuse to do anything with that letter. And I'm going to ask the Secretary of HHS to reject this letter that has no authority in law, again trying to abuse and reject the idea of Affordable Care Act. This bill should go down, and don't answer the letter. This is a bad way to deal with health care in America. I yield back.
The gentlewoman's time has expired. The gentleman from New Jersey reserves. The gentlewoman from North Carolina is recognized.
Thank you, Madam Chairman. And I would just like to point out to my colleagues across the aisle, in the latest Wall Street Journal article of September 10th, one of the things that they point out again is that in the Senate, which is the Democrat majority, they put in an HHS spending bill a sense of the Senate that the provision for income verification be in place. This is something that is very important. It is common sense. And Madam Speaker, wouldn't it be just a major common sense issue to just simply put in place a proactive prevention of fraud, waste, and abuse? I would also like to point out to my colleagues that have discussed the issue of whether or not the Inspector General has the ability to do so. First and foremost, we wouldn't be approaching this in this manner if the rule had not been removed. And yet, we have to have a system in place that will address these issues. There is no reason that we can't approach it from this, again, very common sense approach where we ask that we actually have a rule put in place. We can't simply move forward on this incredible disaster of a law when we are not asking for some verification. I think it's a very simple move. I think it's a very common sense move. I yield back the remainder of my time for now in reserve.
The gentlewoman from North Carolina reserves. The gentleman from New Jersey is recognized.
Madam Speaker, can I ask how much time remains on both sides?
The gentleman from New Jersey has 5 minutes remaining, and the gentlewoman from North Carolina has 6 minutes remaining.
I would yield 3 minutes now to the Chairman Emeritus of the Energy and Commerce Committee, Mr. DINGELL.
The gentleman from Michigan is recognized. The gentleman from Michigan is recognized for 3 minutes.
Well, here we go again. Time of the House is being wasted. The business of the nation is being obfuscated. The Republicans have got more nonsense to put on the floor. We're told that this is important. That's baloney. This is the 41st time that the Republicans have tried to gut the Affordable Care Act. They don't understand that you are supposed to respect the will of the people and to carry forward the business of the nation. What a shame that we have such kind of behavior on that side of the aisle. Now, all members agree that we have to verify the incomes of those getting subsidies through the marketplaces. And that is exactly what is going to take place starting October 1. This is obfuscation and deceit. All income data will be submitted through the marketplaces and will be checked against data from both the IRS and the Social Security Administration under existing practices. This is a lot of witchcraft and baloney. If there is an inconsistency, then additional documentation is going to be required. Furthermore, all the subsidies are reconciled by the IRS when an individual files their tax returns. This is just spinning of people who don't want the legislation to come to be. And again, this is the 41st time we've engaged in this silly exercise. The practical effect of this bill will be denying millions of Americans from getting subsidies for purchasing health insurance. Its purpose is to delay and obfuscate the implementation of the legislation that it is supposed to be helping. To pass this bill is simply going to prove to be a malicious assault on the most vulnerable people in our country and those most in need of the Affordable Care Act. We've seen this song and dance before. As I mentioned, this is the 41st time we've engaged in this nonsense, wasting about $1.5 million each hour we're doing this. I urge all of my colleagues to join me in opposing H.R. 2775. This is political gimmickry. It is going to have harmful effects, and it is intended to do so. I urge that the legislation be rejected and that we stop this nonsense and we get to going forward to trying to see to it that we do implement in a proper way the Affordable Care Act. I thank my good friend from New Jersey for yielding this time to me. I urge my colleagues to reject this nonsense. I yield back the balance of my time.
The gentleman yields back. The gentleman from New Jersey reserves. The gentlelady from North Carolina.
I'd like to have 2 minutes to respond to some of the comments from my esteemed colleague.
Gentlelady is recognized.
Yes, this is theory. That's basically what we have now, because as the rule was removed the week of the 4th of July, there has been no rule put in place to replace it. So basically what we are hearing is the description of how it would be run if the rule was in place. Mr. Speaker, August 5th, frequently asked question document was given out by HHS and the administration, which basically explains the verify process. The Federal Exchange, but outlines no details on how it will occur. Additionally, this fact sheet has no force of law. Even worse, the fact doesn't even pretend to address the verification applications submitted to Obamacare exchanges administered by the states. It simply says that the state can choose whatever sample size it wants to audit. meaning no actual verification may occur before millions of dollars of taxpayer-financed benefits are paid out. While I believe America is a nation of honorable people, we have to remember there are always those who will abuse the system. The fact sheet from CMS doesn't change the status of the rule. States can continue to audit whatever sample size they see fit or simply not audit at all. Mr. Speaker, I reserve the balance of my time.
Gentlelady from North Carolina reserves. Gentleman from New Jersey.
Mr. Speaker, I entertain a unanimous consent request from Mr. Green.
Mr. Speaker, I ask unanimous consent to place in the statement in the record opposing this unnecessary piece of legislation.
Without objection. Gentleman from New Jersey.
And now I'd yield 2 minutes to the gentleman from New Jersey, Mr. Andrews.
Gentleman from New Jersey, Mr. Andrews, is recognized for 2 minutes. Without objection.
I thank my friend from New Jersey for yielding. I'm glad he's back with us. The purpose of this bill is to make it as hard as possible for a hardworking person to get health insurance for their family. So somewhere in America today, there's a person working in a nursing home or a retail store or driving a school bus, and if their children got sick tonight, they could not take them to the hospital with an insurance card in their pocket. They'd have to pay for it whatever way they could, which is not at all. The new law says that that person, under most circumstances, starting October 1st, can sign up for a health insurance policy as good as the one that members of Congress have for a reasonable and affordable price, maybe $30 or $40 a week for that family. This is not someone on public assistance. This is not someone sitting around watching someone else pay their bills. This is a hardworking, tax-paying American. And that person has to report their income, they have to follow the rules, they have to do all the things that are needed to be done. This bill makes it as hard as possible for that person to do that, and that's why it should be defeated. So here we are again. This is attempt number, what number are we using today? 44, 45, 46, whatever the number is. The government is going to shut down on September 30th if we don't pass a budget. The majority said it was going to bring that budget to the floor this morning, but they're not doing that. Instead, we're having attempt number 44 to repeal the Affordable Care Act. This is not only a waste of the country's time, it's an imposition on hardworking people who finally deserve a break after all these years. Vote no on this unwise piece of legislation. I yield back.
The gentleman yields back. The gentleman from North Carolina, Mr. Pallone, has 30 seconds remaining. The gentlelady from North Carolina is recognized.
Mr. Speaker, we are prepared to close. I would like to ask my colleague if he has any speakers remaining.
The gentleman has 30 seconds.
Mr. Speaker, I was going to ask if the 30 seconds left could be transferred to our Ways and Means Committee's time in the next round.
By unanimous consent?
Ask unanimous consent.
Without objection.
Thank you.
Ready to close? Yeah.
Gentlelady from North Carolina is recognized.
Mr. Speaker, you know, here in Washington, we have a way of doing things. And one of those ways is to deal with problems after they've been created. Prior to coming to Washington, I was a nurse for many, many years. And one of the rules that we had drummed into our heads was if it is not documented, it did not happen. This is a rule that is not documented, so it will not happen. It is not enough that we simply ask to be on the honor system. This is a very important piece of legislation that we must ensure the hard-earned taxpayer dollars are protected and that abuses are avoided. I would urge my colleagues to vote yes on 2775 for this purpose. I believe it is incumbent to the American people and the job that we do here in Washington to ensure that this happens. I yield back.
Gentlelady yields back her time. Levin. From Texas, Mr. Brady has 10 minutes. The gentleman from Michigan, Mr. Levin, has 10.5 minutes. The chair recognizes the gentleman from Texas, Mr. Brady.
Thank you, Mr. Speaker. I ask unanimous consent to claim time for the Ways and Means Committee, and I yield myself as much time as I may consume. I rise in strong support of the No Subsidies Without Verification Act because too many of our precious tax dollars are being lost to fraud. That's the simple goal of this bill by Representative Diane Black, stopping fraud and abuse in Obamacare. We wouldn't allow an individual to apply for a mortgage, a car loan, or a credit card without verifying their income. You can't go into a restaurant, a grocery store, a gasoline station, and just pay on the honor system. Yet today, because the White House, frankly, has botched the last 3.5 years, and Obamacare is still not ready, somehow they believe it's okay for billions of dollars in new taxpayer subsidies to go out the door without the bat of an eye on the honor system. And as hard as you work to earn every paycheck, how much more fraud in health care can we accept? Today, we have the opportunity, and I think the responsibility, to hold the federal government's feet to the fire and insist it puts in place strong protections that will end this pay first and chase later model that's been so ineffective at stopping fraud. This bill simply insists that the independent Inspector General of the Health and Human Services Agency certifies there's a real, genuine program in place to stop fraud and abuse in Obamacare by stopping taxpayer subsidies from going out the door to those who aren't eligible. Wow. That's radical in Washington, not paying those who aren't eligible. This will give American taxpayers some assurance that we are protecting their hard-earned tax dollars. President Obama has admitted in Obamacare it's not ready for businesses, so he waived that. And everyone knows it's not ready for families and workers either. Is it asking too much to at least insist it be ready to protect taxpayers against a mountain of more fraud? Now, the White House tells us, and our Democratic friends trust us, we'll verify everything before giving out taxpayer subsidies. Really? Isn't this the same White House that said exchanges may accept the applicant's attestation without further verification? This from the same Health and Human Services Agency that had to backtrack and explain, well, maybe they would audit all of the applications, but not for state exchanges. They're on their own. Sorry, but I'm not buying it, and nor are taxpayers in my state of Texas. Time and time again, Health and Human Services and the White House have ducked the real details about Obamacare. They have no real plan in place. Meanwhile, taxpayer subsidies will flow out the door as individuals pinky swear that their income is accurate. Only members of Congress who refuse to stop fraud, who enjoy wasting taxpayer dollars, and who want to turn a blind eye to wasted money could oppose this bill. I strongly urge a yes vote on this legislation, and I reserve the balance of my time.
Gentleman from Texas reserves the balance of his time. Gentleman from Michigan is recognized.
I yield myself such time as I shall consume.
Gentleman's recognized.
So why are we going through the motions once again? I guess 41 times now. Because the health care reform train is rolling. It's picking up momentum, and the Republicans are once again trying to throw a monkey wrench in its way. In Michigan, 14 different insurance entities are competing. Tens and tens and tens of organizations are working to make this work. Medicaid is now available. Republicans see this happening, and they just can't stand the thought. I reserve the balance of my time.
Gentleman from Michigan reserves his time. Gentleman from Texas.
I yield 2 minutes to the gentlelady from Tennessee, who's really led the effort to stop fraud and abuse in Obamacare, who understands health care herself, the gentlelady from Tennessee.
The gentlelady from Tennessee is recognized for 2 minutes.
Thank you, Mr. Speaker, and I thank the gentleman for yielding. As members of the People's House, protecting the American taxpayer from fraud and abuse is absolutely a critical part of our job. And if, like me, you spent the last few weeks visiting your constituents, you will know that the American people are fed up and they're tired of footing the bill for Washington's failures. That's why passing the No Subsidies Without Verification Act is so important. This bill would protect American taxpayers from the staggering amounts of fraud and abuse in Obamacare exchanges by simply requiring that Obamacare live up to its original guarantee in their original law, that only those who certify to be eligible for taxpayer subsidies receive them. Unfortunately, because this administration's clandestine rule change on July the 4th holiday, this is not currently the case. And it is estimated that as much as $250 billion of hard-earned American taxpayer dollars could be given out in fraudulent Obamacare subsidy claims. Protecting the taxpayers' money is not a partisan issue. The health care law originally written so that only those who qualify would receive federal subsidies in the exchanges. And the Democrat-controlled Senate Appropriations Committee has passed legislation expressing their sense the verification needs to occur before subsidies are doled out. I urge my colleagues here in the House today to join me in helping to protect the American taxpayer. And I call on the Senate to bring this for a vote so that we can send a common sense measure to the President and protect the American taxpayer from fraud and abuse. I yield back.
Gentlelady yields back. The gentleman from Texas reserves. Gentleman from Michigan.
I now yield 2 minutes to the Ranking Member of Energy and Commerce, Mr. Waxman, and ask unanimous consent that the balance of our time be managed by Mr. McDermott.
Without objection, the gentleman from California is recognized.
Mr. Speaker, I thank the gentleman for yielding me time to speak against this bill. The American public should know what this bill is all about. It's the 41st attempt in the Congress and the House to repeal and confuse the American people about the Affordable Care Act. It's a deliberate distortion of the actions that have already been in place to protect the taxpayers. We have letters from the Department of Health and Human Services as well as the Congressional Budget Office that the verification system is in place so that the taxpayers' money is being protected. But the message that the Republicans have been sending over and over again is that we should delay, defund, repeal, but never replace the Affordable Care Act. If they needed further evidence to ignore, just yesterday, the nonpartisan CBO reported that HHS has already put the verification system in place that their bill suggests we do. And, Mr. Speaker, what they want to do is create a duplicative, unworkable process to certify a verification system. And they want to give it to the Inspector General of HHS. But the Inspector General's office has told us that they have no idea what this bill is proposing or what that office would have to do. They have no experience in doing it. So this is not a credible bill. It's a political bill. They can't repeal the Affordable Care Act, so they're determined to keep it from working. It's a clear effort to delay the implementation of the Affordable Care Act. And when I was home, my constituents, particularly those who are looking forward to the legislation going into effect, people who have had pre-existing conditions or inability to get insurance in the past, keep on asking me, is this really going to happen, or are the Republicans going to stop it? I urge we vote no on this bill because it's another effort by the Republicans to stop health care for all Americans.
Gentleman's time has expired. Gentleman from Washington reserves. Gentleman from Texas is recognized.
I yield 2 minutes to the head of the Republican Policy Committee, and a leader in health care, the gentleman from Oklahoma, Mr. Lankford.
Gentleman from Oklahoma is recognized for 2 minutes.
Thank you, Mr. Speaker. This administration has been very proud of the work that they have done to reduce fraud in Medicare, that they have done to reduce fraud in durable medical equipment. Just a couple of weeks ago, there was a huge bust in Puerto Rico trying to deal with Social Security disability fraud that has happened there for years. But for whatever reason, they have chosen on this piece of legislation to look the other way, to actually turn away and say we're going to allow people to self-verify whether they're eligible for the subsidies, when right now people don't even know if they're eligible for the subsidies. If I walked up to 100 people on the street today and asked them 2 questions on that, does your employer provide you a qualified health plan? Most of them would say, I have no idea what's a qualified health plan. And then if I said, do you qualify for the subsidies? Just about every American would say, I don't know. I have no idea. Yet they're being asked, when no one knows right now, to say self-verify that you know one way or the other. They don't have the information. They don't know the information. We don't even know what's going to happen on the exchanges yet. That's not been released yet, and it starts in 3 weeks. So to say to people something that doesn't even exist yet, you've got to be able to say whether you certify for it or not, whether you can say that, yes, I do qualify for this, is absurd. We're just asking the simple question, shouldn't we stick with the original plan on this if we're going to do this? The law itself said that it had to be certified. Then they created a waiver out of thin air and said, no, this is going to be too complicated. We're going to delay that for a while. And then people say, well, what's your plan? Well, I can tell you my state is begging to keep our plan for Insure Oklahoma. We're having to go back to the federal government and request that we can keep the plan we've had for a while, taking care of those in poverty. This is absurd. There is a straightforward, simple way to do this that can be done, but we can say we've created this convoluted mess. Just this morning, I've heard people on the other side say that the train has left the station on this. I've heard healthcare reform, that train is rolling. Well, I can tell you in the Senate, the Democrats are saying, at least some of them are saying, this is a train wreck. And I agree. The train has left the station, and if we don't step out and say this has to stop, then we'll continue to have more and more fraud. We have got to take this on and take it on right now. With that, I yield back.
Gentleman's time has expired. The gentleman from Texas reserves. The gentleman from Washington is recognized.
Mr. Speaker, I ask unanimous consent to enter into the record 4 documents. One is a letter from the President in his opposition to the bill. The second is technical assistance from the Inspector General saying they have no ability to do this. The third is a cost estimate from CBO. And the fourth is a letter from HHS detailing their verification plans.
Without objection, so ordered.
Mr. Speaker, I yield myself such time as I may take.
Gentleman's recognized.
We're here today because we're supposed to be dealing with the CR, continuing the funding of the federal government, but the Republicans are scrapping among themselves and can't figure out what to do. Now, right now, medical research in my district and across this country is grinding to a halt. Grant money is disappearing, laboratories are closing, and potentially world-transforming projects are being set aside. Researchers are being laid off, and students are discouraged from entering the field. There is no end in sight. Now, the question you have to ask yourself is, why is the sequester not being dealt with? It's the mechanism that's breaking our economy for the future, because innovation, research, and our ability to compete in the global marketplace depends on research which starts now continuously. Not to mention the life-saving cures and treatments we're losing because of this empty labs. So what are we doing here today? Thank God for Obamacare. We got something to do. We can try and repeal it for the 41st time. Obamacare, folks, is not going away. It's about to take off. In Washington, Oregon, and California, we can't wait. The rest of the state may be sitting on their hands, but we aren't. And the fact is, even Senator Cruz from Texas says, quote, you aren't going to win this one. Now, maybe these endless, pathetic kind of tantrums that we have out here every 2 weeks wouldn't matter if there weren't so many much more important things that need to be done. We get it. I mean, we really do understand it. The American people even get it. That the Republicans really, 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 really don't like this law. But can't we move on? Stop screaming about wanting a budget and pass one. You've had the budget. You won't put the the people forward to go to have a conference committee. Quit dancing around with the CR. America needs jobs, and you can do something about it. It's not just some force of nature we can't control. Our economy is weak because we're starving it. Let's do something about that. And instead of this biweekly announcement that you dislike access to affordable care, I urge my colleagues to vote no. I reserve the balance of my time.
Gentleman reserved. Gentleman from Texas.
I yield 1 minute to a key member of the Ways and Means Committee, the gentleman from Arkansas, Mr. Griffin.
Gentleman from Arkansas is recognized for 1 minute.
Thank you, Mr. Speaker. When I look across this country and look at who opposes the President's health care law, Obamacare, it's not just Republicans. New York Times today says the AFL-CIO is fed up with the law and ready to get it repealed if they can't fix it. Employers across this country are fed up with it. That's why the President delayed it for a year till after the elections. Come on, let's get a grip and face reality. But my dislike of the law aside, that's not what this is about. This is about the federal government handing out money without verifying who's getting it. That's ludicrous. It's unbelievable. We have to verify. When I, as an Army reservist, sign up for TRICARE Select, because now I'm thrown into the Obamacare exchanges, if you buy alcohol, you have to show an ID. I mean, this is pretty basic. We just want to verify who's getting government cash. That's it. And that's why I support the bill. It's common sense. Let's pass it. I yield back.
Gentleman yields back. Gentleman from Texas reserves. The gentleman from Washington is recognized.
Mr. Speaker, I yield 2 minutes to the gentleman from Texas, Mr. Doggett.
Gentleman from Texas, Mr. Doggett, is recognized for 2 minutes.
19 days. In just 19 days, millions of working Americans can apply to receive premium assistance tax credits to help them get health insurance. These are neighbors who were previously denied coverage or who were excluded because of a pre-existing condition or because a small employer could not afford to provide health insurance. And today's bill is about one thing, and that is to deny those Americans their lawful opportunity on October 1st to obtain health care security. This bill is certainly not about fraud, because there is already a comprehensive system to prevent overpayment and verify income. This very afternoon, a family that suffers severe injuries in a traffic accident on I-35, or a San Antonio family that is notified of a dread disease, those families that lack affordable health insurance are suddenly overwhelmed with medical bills, and they deserve an alternative, and that alternative is coming on October 1st if these folks can't stop it. This bill would have pulled the affordability rug right out from under our working families just as they're beginning to learn about its availability. Yes, this is the 41st time that they've tried to delay and dismantle and deny the rights of American working families. We know it won't be their last vote. In fact, next week they're so intent on blocking American families from getting health insurance coverage, they're willing to shut down the entire federal government. And as if that weren't enough, next month they propose to default on the full faith and credit of the United States of America for the first time in our history for the sole purpose of denying American families that don't have insurance now some health security. I think it's wrong. They talk about trust. Well, I don't think we should trust these zealots with our health care future, and I yield back.
Gentleman's time has expired. The gentleman from Washington has 3 minutes remaining. The gentleman from Texas has 1.5 minutes. The gentleman from Texas is recognized.
Yielding myself 15 seconds. Yesterday we learned the federal government is paying millions of dollars to prisoners for unemployment benefits. Millions of dollars of your money to cons in prison. But don't worry, we'll stop the fraud in Obamacare. I reserve the balance.
Gentleman from Texas reserves. Gentleman from Washington is recognized.
Mr. Speaker, I yield 2 minutes to the gentleman from New Jersey, Mr. Beskrell.
The gentleman from New Jersey is recognized for 2 minutes.
Thank you, Mr. Speaker. Like my Republican colleagues, I too am concerned about fraud in any public program, whether it's Obamacare, food stamps, Medicare. Who could be against verification? But this is not about verification. Again, the 41st failed attempt to submarine reform in health care. The question before us today is whether or not the risk of fraud in Obamacare is so pervasive that we should shut down an essential part of the law. My friends on the other side would have you believe that the administration's decision to delay income and coverage verifications leaves the health care marketplace vulnerable to rampant fraud. This is not the case. First, federally operated and partnership exchanges still will verify such information beginning in 2014. Only 16 states in the District of Columbia will wait until 2015 to begin more comprehensive verification. In those instances, the incentive to provide false information is greatly overshadowed by the benefit doing so. Lying on the exchange form carries with it a penalty of $25,000. On top of that, anyone who provides false income information will have to pay back the extra subsidies when filing a tax form for 2014. Additionally, states will audit a statistically significant number of individuals, meaning that everyone has an equal opportunity to be audited. Finally, fighting fraud requires an investment of funding and resources. How dare you get up here and talk about a plan when you in the regular budget want to cut every penny from resources, from research, from helping us get to the point where American people will be served. Look, you can't stand success. Help us improve the system, not continue a system where patients are playing second fiddle. And with that, I hand you back.
Gentleman's time has expired. Gentleman from Washington reserves. Gentleman from Texas.
Mr. Speaker, I would reserve in case the gentleman from Washington has additional speakers or would like to close on his side.
Are you...
We're prepared to close.
You're prepared to close?
Yes, sir.
I yield 1 minute to Mr. BLUMENAUER to close our arguments. Mr. BLUMENAUER.
Gentleman is recognized for 1 minute. Gentleman from Oregon.
Thank you very much. Let's be clear. This is not about the integrity of the tax system. There are any number of areas where we rely far more on discretion individual taxpayers, and there's no appetite actually to move in those areas. My Republican friends are not interested in providing adequate resources to the IRS to be able to appropriately enforce the tax law right now. And we have hundreds of billions of dollars of taxes that aren't collected. But this is part of a mean-spirited and short-sighted effort to sabotage the health care reform effort. Bear in mind what's going on in states around the country. In Missouri, the Republican legislature has been on a rampage that will even make it illegal for state employees to tell Missourians what they're entitled to under state law. This is a new low in, I think, political malpractice. The Republicans are willing to flirt with shutting down the American government in their attempt to prevent Americans from getting health care they're entitled to under the law. This is wrong. I strongly urge that we reject this mean-spirited approach.
Gentleman's time has expired. Gentleman from Texas.
Mr. Speaker, as I yield the balance of our time to the gentlelady from Texas, I make the case. This is a simple choice. Those who want to stop fraud in Obamacare support this bill. Those who want to turn a blind eye to that fraud oppose it. I yield the balance of our time to the gentlelady from Tennessee.
The gentlelady from Tennessee is recognized.
I thank the gentleman for yielding. Mr. Speaker, in closing, even the White House veto threat actually proves the need for the No Subsidies Without Verification Act. The White House says that H.R. 2775, which simply requires the administration to verify whether people are eligible for taxpayer-funded Obamacare subsidies before they're doled out, would create delays, is what they say. It would create delays. But the veto threat then goes on to say that the bill is, quote, unnecessary, because the administration officials claim they already have, and I quote, an effective and efficient system for verification and eligibility. So which is it? Does the Obama administration have a way, other than the honor system, to verify whether someone is eligible for taxpayer subsidies, or will requiring the administration to have one create delays? If they had a transparent verification system in place, one that actually worked, this bill would create no delays. And the administration should actually welcome it. And so should all of the members of this body vote for this. That's why we need this bill, because we need independent verification that programs are in place before taxpayer subsidies go out the door. For all taxpayers, I urge my colleagues to vote yes on H.R. 2775. Yield back.
Lady's time has expired. All time for debate has expired. Pursuant to House Resolution 339, the previous question is ordered on the bill as amended. The question is on engrossment and third reading of the bill. Those in favor say aye. Those opposed, no. The ayes have it. Third reading.
A bill to condition the provision of premium and cost-sharing subsidies under the Patient Protection and Affordable Care Act upon a certification that a program to verify household income and other qualifications for such subsidies is operational and for other purposes.
The question is on passage of the bill. Those in favor say aye. Those opposed, no.
Mr. Speaker, I
The gentleman from Washington.
Yeas and nays.
The yeas and nays are requested. Those favoring a vote by the yeas and nays will rise. A sufficient number having risen, the yeas and nays are ordered. Members will record their votes by electronic device. Pursuant to Clause 8 of Rule 20, this is a 15-minute vote on passage of the bill. It will be followed by a 5-minute vote on approval of the journal. If ordered, a 15-minute vote. On this vote, the yeas are 235, the nays are 191. The bill is passed without objection, and the motion to reconsider is laid on the table.